Hello, everyone. Welcome to episode 6 of the Self Care Awareness Month live series. Our guest for today is Keshav Sharma. She's a psycho-oncologist. Um, okay, trying once again. I have accepted your request. I am not sure what's happening. Ma'am, I'll send you an invite and maybe you try.
Tanya, good
Hello,
evening.
ma'am. Good evening. I'm so sorry for the glitch.
That's okay. That's okay. I think technology was just testing our patience, and yeah, that's okay. So, hi, good evening. How have you been?
Good evening. I'm good. Firstly, happy Guru Purnima to you and to everyone. How are you?
I'm doing good. I'm very excited and happy to be part of this life, and it's been a while that we have connected through this medium. So, yes, happy to talk about self care today.
Thank you so much, ma'am, for joining in. It has become a yearly thing for me that I have to do a conversation with you, and I get to learn so much from you. So thank you so much. Today's topic is uh, it's self-care awareness month till the 24th of July, and since you work into palliative care and psycho-oncology, grieving is something which is very difficult for all of us, and I think there we should discuss few self-care tips that someone who is experiencing grief can use to make the process little easier, although it's different and it's different for everyone. It takes their own time to come out of it, but I hope this conversation helps. So starting with my very first question, that is it right to even practice self-care during grief?
Of course. And see, I think before self care, talking about self care in grief, what we need to understand first is the process of grief. And grief is not a disease, it's not a disorder, it's an experience that all of us go through. And when we talk about grief, it's something that you, me, our viewers watching us, all of us, almost everyone, either have experienced the grief, have lost someone, is grieving in the active grieving process, or will grieve in their lifetime, right? So hence it becomes very, very important and essential for us to be taking care of ourselves, knowing that, I think first of all is acknowledgement of the fact that grief is a normal process. It's not a disease, it's not a disorder, it's not a problem, it is an experience that we all live through. So yeah, and obviously the question that you asked, of course it is important to practice self-care during the process of grief.
Okay. How can I recognize that when my grief is becoming overwhelming and I need additional support or professional help, um, and only self care won't help me?
Of course, because since grief is a process, it's Again, it depends on the kind of attachment that we had with the deceased one, what we are grieving, who are we grieving. And grief is not also only loss of loved one. Grief is also losing a situation, opportunity, uh, leaving a workplace where you had like really good time. When children move schools to school, grieving the whole, the separation that takes place. Grief happens because there was an attachment. If there is attachment, when that detachment happen, when we forcefully take it out, separate, the process of grief will start, of course. And how do I recognize it? Number one is when it's affecting my physical body, because it starts from the body, right? We see certain physical changes in our body. There is a change in appetite, there's change in sleep pattern, there's change in emotional dysregulation is there, cognitive dysfunctions, we are not able to focus so much. There is there's a whole lot of changes that take place in one's life. That's when we recognize the process of grief. And what how we start with it, how the self-care process starts with the taking care of one's body, because that's where it starts, right? What do we do? What are the signs? Of course, the physical changes in the lot of things that you feel that this is you, the normal self. And when an experience took place and you're feeling a uh, certain emotions, and which is making it difficult for you to deal with the regular day-to-day life. And of course, that's when one needs to seek help. What kind of help? Not only self-care, of course, going for a therapy, recognizing, and especially when we talk about the grief through the loss of loved one, I think what helps is not regular counseling, but seeking support from a grief therapist, grief counseling, because it's a specific area that we need to recognize. So, yeah.
Absolutely, ma'am. I agree with what you say. What are some practical steps that I can take to incorporate self care into my daily routine while grieving? Because, of course, when one is grieving, the routine changes, everything around them changes. So, what are some self care tips that I can incorporate?
Yeah. So, I'll again say the same thing. Self care starts from taking care of one's body, right? Self care starts from the body, and what we do first is the food, water. Are we hydrated enough? Are we eating the our meals in time? Taking sunlight, sleep, safety, connections. If I am maintaining all of it, is part of my self care. Self regulation is another part of it, finding our spiritual self, who I am, what the meaning part of it. Self improvement, self movement, which is again the exercising and other things. So again, when we say that, how do we take care of self during the grieving process, and when we have a typical routine? Grief is not a task, right? Task, we task is a mourning, when the right after the the loss of loved one, the initial period, the immediate periods is a mourning period. That is a part which we call is the task, and there are tasks of mourning. But grief is something that there's no time period, there's no timeline to it, that one can say, I'll be grieving for a month, and so I can take off from work and off from everything, and I'll just grieve and then come back. That's not how it works. Grief is a part and parcel of life, and along with, and we can do all of these things, like I said, very basic, from taking care of your body, body and mind both. And the bare minimum one can do is to be able to take food in time, hydrate enough, exercise, do the physical movement, talk to someone who you feel connected to, or who you feel will understand what you're going through, right? This is not the time you directly go to therapy or something, but just connections, your friends, your family, your support system is something that one needs to reach out in a regular routine when you have other things going on, and when grief is going on in a normal process, right?
Yes, ma'am. through your session and all the sessions that I did across self care, the one common thing that I got from everyone was food, water, exercise is the basic self care that you do. However, it is also connected to the next question that when this period is going on, when you get the news, the few initial days and weeks, you are so overwhelmed with feelings that things just feel impossible. You don't want to eat, you just want to not be in the denial phase. I don't accept that this happened. So even food and water becomes difficult. You don't feel like eating. You try to eat, food doesn't go down your throat. So how do you deal with that situation?
See, here what we need to understand that grief affects the body first, right? It affects your brain, it affects your sleep, it affects your appetite, your tears, your, everything, the body part of it. So grief, and we would have heard about this syndrome called uh, broken heart syndrome, right? So broken heart syndrome is a very much real thing, right? What really happens is because the cortisol levels go up, and it becomes the dysregulation happens in the hormones, right? So it is affecting your body, it is affecting your brain. Because of the high cortisol levels, the hypothalamus is the part which regulates your appetite, etc. So it is affecting at that moment, but we also need to understand that's a very brief time. What one needs to do is not isolate themselves, be around people, so that when they don't feel like doing anything, but there is somebody who can just be there. And you don't really have to do a lot of things at that point of time. Say, it just few days of losing someone, and few, it's a very initial period, and you're still mourning, and still, the bereavement process is going on, and you can't expect yourself to have a normal life, right? Because the attachment was there. You are your stress hormones are absolutely haywire. There is also the role of tears. A lot of researches that have happened on tears. There are different types of tears. So some happens because of the allergy, elements, smoke, dust, and all. That is fine. That's usual. But when there are stress, or when somebody grieves because of the emotional tears are there, what happens as a result of emotional tears is it is releasing your stress hormones also, right? So that is why if you see, sometimes you feel so overwhelmed, you just feel your chest so full of emotions, and the moment you cry it out, you automatically feel the release of emotion. So crying is also a healthy part of it. Initial period, sometimes because we are surrounded by certain responsibilities, certain people that we need to show that we are very strong. Especially this happened to male members of our society, because they are loaded with a lot of responsibilities at that point of time. So crying doesn't take place. Crying, however, is a very, very healthy part of it. When one cries, the hormone level gets settled, and you actually feel very settled over there. So initial period, of course, you will not want to get up from your bed, not want to eat, the food will not go inside. You don't have to force yourself, right? All you need to do is just be. You want to cry, cry. Because of course, and acknowledging uh, your grief, someone acknowledges what you're feeling, is when that happens, you automatically feel uh, heard. And when we talk about grief also, and David Kessler talks about the needs of grieving, and one of the first needs is to acknowledge the grief, acknowledge my emotions. This is the one need all people who are grieving would like to be witnessed. Because when someone is grieving in isolation, they don't know who to cry, because they can't cry enough. Because you need the we grieve in togetherness, we don't grieve alone, right? So when that happens, when you feel that someone is there, I am being heard, my emotions are validated, what is happening to me is a normal process, you automatically start feeling better. And when there is a support to you, support around you, you would want to, gradually, you will not want to eat, sleep, just do the normal activities that you used to do on the other days. But it will help you with the bare minimum of eating. Instead of having 3 meals, you would at least can have 1 meal. And this, I'll give you the example of culturally how it is in a lot of cultures. When the a loss happened, the during the mourning days, people are not eating 3 meals, they are eating 1 meal, because practically they cannot, the food doesn't go below their throat, they cannot swallow it, it's very difficult. But at the same time, and that's how it became a part of culture. Okay, don't eat all 3 meals initial 10 days, or 11 days or 12 days, but at least have a meal, at least have 1 meal, right? And part of culture, how our culture is there, our rituals are there, that also has a very strong role in it, right? In the beginning, and what you said, when we don't feel like doing anything, this happens in the beginning, in a very beginning, because as long as the time comes in between, the grief doesn't become smaller with the time, but your coping start becoming bigger with time, right? You start to get more support, you know what you can do, you know who you can reach out to, you feel automatically settled somewhere. But then the bouts of grief will keep coming back, so you don't really have to push yourself to do a lot of things, but just the bare minimum would do.
Yes, and as you said, that initial days are difficult, but after a point when 13 days are over, 2 weeks, 1 month, at some point we have to get back to the routine. That
Yeah.
is how life moves on, and that is what people around us also tell us. So how do I find that balance, the need to grieve when responsibilities of the everyday life start coming back, that I need to also go back to school, or I need to get back to my job?
Yeah. So again, grief is not a task,
Yeah.
right? It's not a full-time job that now I'm grieving, I'm full-time grieving. One can actually full-time grieve, part-time grieve. Grief is very, very individual. It is very, very subjective in nature. It's not that all people grieve in the same way. For some people, it will be fairly, the work can become a coping, but some people, they can't focus on work, right? I'll just give a bit of a self-disclosure. When I lost my mother, it became very difficult because I used to work in a hospital setup. Currently, I work in a hospice. But at that time, when I was working in a hospital setup, uh, because I lost my mother to a stroke, and the looking at the paralysis, wheelchair, hospital visits, MRIs, all these things would trigger me. And for me, especially, the my workplace was a hospital, and it would, the thought of going back to work really affected me a lot. And at there came a period for week 10 days that I just kept saying, I'm not going to continue with the hospital, I'm not going to continue with the work, right? Now you see here uh, how it is a normal process. I practice as a grief therapist, I've been working as a psycho-oncologist, I see loss. But when it happened to me, I had to be normal, I had to feel it the way it felt, right? I had to allow myself to feel what I was feeling. So for me, going back to work became so difficult that if I will look at a wheelchair, I'll just get very, very activated by that moment. If I look at a person of my mother's age, I will again, my eyes will just get very teary. There have been times that I've actually cried at my workplace. But gradually gradually there comes your coping, then you start making sense of things, and then ultimately you start finding meaning in what you do, why you do. So what you said is, uh, you one will find, for some people, work is a coping. I also know a few of my clients, for them, that finishing initial 4 5 days, they really want to go back, and they don't want to go back to that same place, because They were busy with their friends, the place has changed, now they have work pressure. So there's something else which has actually distracted them. Distraction is fine. There's again no right and wrong way of grieving, but again it's fairly very individual. If you initially feel it's difficult, take time, take break, stay away, think through, reach out, try to make sense of it, talk to people who really get you. uh, and what helped in my case was my friends who were also therapists. I would tell them, I'm not going back. And my boss at that time, Dr. Parekh, I would tell sir that, sir, I'm not coming back. And he was like, okay, you take your time. You don't want to come for a month, that's fine. Don't come for 2 months, that's fine. But I'm not letting you leave the job. So my support system at that point of time really helped, right? And that is what I think, that's what the role of support system in the active grieving process is. uh, it is very very individual. People do it, it can become very subjective. Some people find uh, work can be coping for them. For others like me, it can become trigger. So there is no uh, set answer to it. But if you feel it's difficult, you find a lot of difficulty in it, just take a step back. You don't have to push yourself to it and burn into the whole process of it, but just taking a step back would definitely help.
I agree with you. And when you shared your personal experience, I just remembered that I have also been grieving for the last month. And like you said, that looking at a wheelchair triggered you. When I lost my grandfather, I saw him in everything around me. So, in the pouch that he gifted me, or his favorite fruit if it was at house, everything around I used to see and I used to feel reminded of him. And then I think studying became very, very difficult. Getting back to academics was very difficult. But I think my friends and all my family members, my grandmother, talking to her, and basically the support system really helped coming out of it and getting back to the normal. So I agree with you what you said. Support system is really important during this time. Thank you for sharing your personal experience as well. I know it's difficult. My next question is that what are some common myths about grief and self-care that people should know about?
When we talk about myths around grief and self-care, a lot, and they are all very all those things that probably we were doing in the past, right? Be strong. You will you face it, time will heal. Avoid the memories of the deceased one. That can be a strategy. Time will heal. Grieve alone. Get over it. uh, Truly nobody can get over it, right? Time will not heal. Time will only, the grief, like I said, will remain the same. But what will grow is your coping. What will grow is you as a person, and you will start looking at it, an experience, right? It will be there. So I think myths around self-care, when we talk especially in grief, is that uh, get back to work. What is happening? It's been enough. You've been enough of grieving, enough of crying. Get back to this thing. But it's never enough. It's when we especially talk about losing someone to life, a loved one, a parent, a grandparent, a spouse, a child, a pet. It's not really easy, because you will still see that experience as it just happened. You suddenly wake up from sleep and you see why they're not next to you. Suddenly, if you're staying somewhere away, and when you get back home, probably after years, you will still, the reflexes, like, where that person is, you will probably automatically call them, right? So uh, get over it is a very very common this thing, that enough of it. uh, but when you look at the timeline of grief, it's very interesting. uh, the initial periods is the mourning period, right, where the outward reaction to the grief will actually come up. But the first 2 years is early grief. What, again, the David Kessler's classification, the first 2 years is early grief. You cannot say that, oh, it's been a year now, enough of it, it's been a year that they have gone, why is it still triggering you? Especially, when you had a distant relationship, say, per se. One is that you had an attachment, but grief gets very, very complicated. And the myth could again be that you never had a good relationship with that person when they were alive. You were just constantly fighting, but now why are you crying? Is, just get over it. Get over it. It's something that we all hear. And I think these are the things that we were also doing before we actually got sensitive towards the this particular area, or sensitive, and when we actually experienced it, uh, we learned it hard way. And I think this is few statements that one should be avoiding in general.
Absolutely. And what you just said, that sometimes people say that, you were fighting with that person, you are not so connected with that person, and then later when they are no more, you have that guilt. So how do people deal with that guilt? So the feeling of guilt or self blame during that period.
I think uh, understanding what the guilt is about, the realistic guilt and the unrealistic guilt. Why say realistic and unrealistic? Say someone was taking care of someone, their loved one, and they were taking all that they could at that point of time, but suddenly they had to go back to their work because of some other community or some other member of the family needed them the most. And in that absence, someone passes away and they lose guilt that I did not do enough, I did not take them to a better doctor, I did not do enough, right? That is, one needs to really reflect what is realistic and what is unrealistic in that case, right? Another thing is identifying the source of guilt. Where is it actually coming from? What are the thoughts behind it, right? uh, because of the guilt and the burden and all those negative thoughts around it, the negative automatic thoughts will actually spike in. What we need over there is a cognitive restructuring that probably can actually help. Focusing on what is that I can do now, rather why did I do not why was I not there, why did I not do then? Because the guilt, understanding why the guilt is, understanding your relationship with the deceased one, right? What was it reflecting on the whole picture of it? And I think ultimately creating a meaning out of the loss, meaning out of that relationship, focusing on what is that can be done now, rather than just being in guilt. And I think if someone is alone sitting and they're not reaching out, there's no one who can support them, and they are not seeking support, this loop of thought can keep coming back, and one can actually just stay in those constant thoughts. I didn't do enough, I should have done that. And that can actually trigger much more negative thoughts. But what one needs to realize is, what is that I can do? The first thing that I said is realistic and unrealistic. Now is what I can do. Doing meaningful things out of the experience. Here I'll give you the example of this Netflix series we have, the Something on Fire. This is a series on where this couple lost their two children in a fire accident in Delhi. So there's a Netflix series on it, and they lost their children. They could have been, the initial phase was the guilt, like, why did we send our children there? We shouldn't have let them go there. But ultimately, how this couple came out is, with the meaning. So the fire safety that you see in most schools in Delhi or other places is because of their effort. They actually went to the court and fought about it, that there has to be certain safety measures. There's another example. One of the person who lost his son in a accident, right, in a road traffic accident, and that accident didn't happen because of overspeeding or other things, but there was a pit hole on the road, in the middle of the road. After he lost his son, again he could have been, the guilt was there, but finding meaning out of that guilt, that I will not let anyone, and that man actually came up with this thought that I will not let anyone die because of the same reason why my son went. So he did not went to the court or government or something, but after work he will just try to fill as many uh, pit holes on the road as much he could, right? That's the power of reflection. You reflect what is that I could do and what is that I can do now, right? And creating meaning from loss is the biggest thing I think one can practice.
I agree with you. Uh, So when this happened with me, my grandfather was in the US. I was in India. I couldn't see him last time. I always had that thought in the initial days that if I had been in the UK, I could have flown down to US. So that thought of not being able to be there with my grandmother always bothered me, but then I understood that everything happens for a reason and destiny. So
And I think
um, I
also, Chaitanya, realizing what's our limit, right?
yeah,
There will be a lot of things that one would feel that, and they would be doing their best in their capacity. Sometimes you may not be around your loved one and do certain things, but uh, that's your limitation. You can't be there physically present. But that doesn't, and it will spike in, because when someone is sitting grieving alone, there's no support system and they're not able to think beyond the box at that moment because they're too vulnerable. The guilt is something, again, guilt is also comes as a coping for a while, because I feel guilty because it's my helplessness. I could not do. I can't say that I didn't do it, but I'll feel guilty that I could not do it. Right. So it's a self blame. It works well for a while, but again, going seeking support, talking to your loved ones, and talking about it, talking what you really feel, really does help and does make a whole lot of difference, right? So realistic and unrealistic is something one needs to uh, realize and reflect on.
absolutely. As we wind up this live session, my last question to you is: what are some resources available for people who are grieving, and your concluding thoughts for this session?
When we talk, we are living in an AI world right now. We have a lot of resources available online. There are, online support groups, grief support groups. There are online apps which can help you, maintain your self care routine. Uh, I think there are a lot of different things for your physical needs. There are different applications, there are different sources, guides, books, but concluding what is self care, what helps, there is no standard line. What probably helped me will not help you, or what helped you may not help other people. So, identifying and understanding what is your self care activity, right? There was one question that you asked, like, what do you do on the days when you don't feel like doing anything, right? You may not want to do anything, but maybe you just want to be with your pet, be lie down on a bed, not get up from the bed, and your pet is around you. That is self-care. You're spending time with your pet, right? And you're getting sleep. That itself is self-care. So taking care of small things, and be aware of actually what is happening around. not being too hard on yourself that, I should be doing this. This is the standard, gold standard. There are no standards when it comes to self care. You build your own standards, right? What you will find so many resources online, so many resources everywhere. Too many people will tell you, and in the previous sessions, like you had, a lot of people would have told about, do this, do that, do that, but they're all very specific. It's not that everything will work for everyone. What I said today, that take care of eat, sleep, connections. Maybe you just somebody want someday, you don't want to go to your friends because you feel that you don't feel connected to them, right? But sometime, just being with yourself, reflecting on this may help. uh, Therapy, we say, is a, one, when you don't know what to do, go seek therapy. But sometimes you just expressing your emotions with your friends can also help you, right? So, uh, people, taking care of a plant. For me, the self-care activities are very different, right? A lot of people suggest that, you should do relaxation, mandala, uh, really good techniques, but personally it has never helped me. I in fact feel very very stressed out when I see too many patterns, too many too many things that I have to fill in. uh, Relaxation, again, can be contraindication to depression, right? So there are a lot of things, and one doesn't have to be very hard on themselves and actually identify what really works for me. What is that I like, right? Maybe just cleaning your room, cleaning your cupboard, go take a long shower, sing in the shower, do anything that you feel is makes you calm, makes you relaxed, and helps you. And I think one thing that works for all probably is connection. uh, Self care is starts from taking care of yourself, and there are a lot of ways that one can really practice. So, yeah.
Yes, connection with the self. Thank you so much, ma'am, for joining in today and giving all the beautiful insights. I really enjoyed the conversation, and I'm sure everyone did and everyone learned a lot. Looking forward to another conversation with you. Um, Thank you so much.
Thank you, Chaitanya. Thank you, and keep doing the good work that you do, because I saw you as a mental health advocate in Fortis, and you are one person I know who has continued the goal of advocacy. Keep doing it and keep doing the great work.
Thank you
Thank
so
you.
much. Thank you, ma'am. See you.
Thank you.